Today we're talking knee replacement surgery. You've heard it all before. You'll never bend your knee properly again. You'll always be in pain. You'll set off airport scanners forever. Well, I'm here to tell you most of what you've heard about knee replacement surgery is flat out wrong. Today we're going to bust 5 of the biggest myths that stop people from recovering confidently or even from getting the surgery they really need. Here's what we'll cover. The 5 biggest myths about knee replacement surgery, the real truth about what recovery looks like, and at the end, I'll share one bonus insight that will completely change how you think about knee replacement success. Stick with me, it could save you months of frustration. I'm Gavin Noble from Gavin Noble Physiotherapy here in Lisburn and from the Gavin Noble 10x Physio channel, where we help people stay pain-free, mobile and strong. If you want expert advice to recover smarter and stay out of the doctor's office, hit that subscribe button and let's get into it. This one's the most common. People think that once you've had a knee replacement, your days of bending, squatting or kneeling are over. That's just not true. Here's the reality. How well you move afterwards depends more on your rehab and consistency than the surgery itself. Yes, it takes time, but with the right mobility work and strength training, most people regain excellent motion. The problem is too many people stop too early or get scared of moving. The joint is strong, it's designed to move. You just have to reteach your body that it's safe. I've lost count of how many people have said, my friend's knee still hurts years later, so mine will too. But everyone's journey is different. Persistent pain usually comes from stiffness, weakness or swelling, not the implant itself. Once you rebuild strength in your quads and glutes, that pressure on the knee drops dramatically. So no pain is inevitable. It's a signal that something needs adjusting, not a life sentence. Have you heard a scary myth about knee replacement surgery that put you off? Drop it in the comments below. Let's bust it together. And stick around because at the end, I'll share one little known secret my patients use to speed up recovery that no one talks about. Let's clear this one up. Modern knee replacements don't automatically set off alarms at every airport. Most are made of titanium or cobalt chromium alloys that often pass through scanners undetected. Even if they do trigger it, all you need to say is, I've got a knee replacement. They'll scan you with a handheld wand and send you on your way. So no, you don't need a doctor's note or a laminated card from 1987. This one really frustrates me. Age alone doesn't decide how well you'll do after surgery. Your strength, mindset and consistency do. I've seen 75-year-olds recover faster than some 55-year-olds because they committed to their rehab and stayed active. If you can walk into surgery with decent strength and determination, you'll walk out stronger. So don't let age or fear stop you. It's never too late to get your mobility back. This myth dates back decades. Modern implants are built to last 20 to 30 years or more, sometimes a lifetime, if you look after them. The biggest factor isn't time, it's how you move and maintain strength. If you stay active, avoid obesity, and keep your muscles strong, your implant can last well beyond that first decade. All right, here's that bonus insight I promised. The patients who recover fastest after knee replacement all have one thing in common. They move every single day. Not big workouts, not painful stretches, just motion snacks. Small, frequent movements that keep the joint flexible, the muscles active, and the brain confident. Do that, and your recovery keeps compounding week after week. So let's recap the myths. You won't lose movement forever. You won't be in pain forever. You won't set off alarms everywhere you go. You're not too old, and your implant can last decades if you treat it right. I'm Gavin Noble, and if you found this helpful, hit subscribe to the 10x Physio channel for more expert advice on staying pain-free, mobile and strong. And if you're recovering from surgery right now, check out my next video, which is top 3 mistakes after knee replacement that stall healing. It's the perfect follow-up. So I'll see you in the next video.